a raft of issues that are before us and the troubles related to our healthcare system. Today's Thursday. Monday, there was an announcement given that for renal patients below the age of 18 years and above 60, the NHI was going to take up the bill for their treatments when they go to these centers for healthcare. We did a follow-up. We went to the facilities as of Monday. It had not kicked in. Tuesday had not kicked in. Then we're told that, well, there are processes afoot to ensure that this rollout is done. Let's analyze the two ends of the stick. First of all, considering the health of the economy now and what we know, as you've explained to us carefully, from a pure policy perspective, is it feasible? Does it make sense?
Yes.
To take this action?
Yes. Yes.
To pay for persons under 18 and above 60?
Yes.
It does?
Yes.
Why?
If you read the National Health Insurance Act, persons below the age of 18 and over 60 are not supposed to pay for healthcare in this country anyway. It's part of their core mandate.
Yes.
So let's situate that. Number two, nowhere in the world does any patient pay for renal dialysis, even in advanced countries, because it will bankrupt you. Nowhere. I challenge anyone to show me anywhere that the health system doesn't take care of renal dialysis. Second. Number three, I challenge anyone to show me how the NHIS is affected by the myriad of excuses that the government gives around why we find ourselves in an economic quagmire. COVID, the Russia-Ukraine war. They don't affect the NHIS. Not at all.
Because of the levy?
If you go to a filling station now, if you go to a supermarket, you pay the 2.5 levy, whether there's war in Russia and Ukraine or not. You see, this country, sometimes we do things that shoot us in the foot. You have an act that says, collect this 2.5 levy. It has a name, NHIS levy. By the act, it has to go into the NHIS fund. They have to have their own fund managers. And then they use part of the money to pay their providers. And if they are good fund managers, they invest the remainder of the fund appropriately for a rainy day, so that when they get hit, they can fall on their investment. That is how any national health insurance scheme or any health insurance scheme works.
Should run. Is that what's happening?
That's what the act says. But because of the human beings we are, we have conspired to disobey the act. We've never had the National Health Insurance Fund. They don't have their own fund managers. And when we collect the money, it goes into the Consolidated Fund. And then we take part of the money and give it to the NHIS as though they are paupers. They are not supposed to be paupers. We have an act of parliament that says the money should go directly to them. So then what happens? When it goes into the Consolidated Fund, they then release part, like I said. If you look at the trend of releases, because the NHIS has put it up, there's never since the NHIS came into being
existence
that they have had 100% of their collectibles released to them. Since the days of President Kufuor, never. The highest has been around 77-80%. But what did we see in 2017? This government came in, and we have an act of parliament which says the money should go to them. We had been breaking the law anyway since the enactment. But these ones came in and they said, you know what? No, we know better how to use the money that you have paid. You have paid.
You, the citizen, has paid.
So that when you're unwell, it will be used to manage you. So in your wisdom, you say, I want to pay for this money so that I set aside to manage my ill health or my checkups and all that. They say, no, we've capped 75% of it. We are going to take it, use it how we deem fit, because you who paid doesn't know what you want the money to be used for. And we'll give the NHIS 25%. What did they do? They went to Parliament to get an LI pass.
And it was passed.
Yes. And none of us challenged it in the Supreme Court to say the act was being breached. That is what I mean by the keeping quiet is not an option. I, for one, is on record, before even the encampment came, there was a lot we put out from CDD to say,
Stop.
whoa, stop this. It's going to bankrupt the NHIS. What did they do? They gathered their foot soldiers to go on social media and hurl expletives, because that's what politicians do. Was it going to call us? No. We then put out further data to say, you cannot take that money you are capping, because the act says it's for the NHI. So at best, government is borrowing for the NHI.
Yes.
And someday you'd have to repay
back.
it.
Yeah.
Nobody did anything. And as politicians are, they test the waters to see if the citizens would react to their stimulus. We didn't react. So they further increased the cap from 75% to 82.5% and said they're going to give the NHI 17.5%. We still sat down. Right? We didn't say anything. Till now, the government is clearly indebted to the NHIs. But we make them paupers because even when some small release has been done to them and they are running out of cash and their providers are their throats, when they go to government says, come and justify how you use the money we paid to you. It's not the government's money. It's the NHIS's money. And they are being
Monies we've paid for.
We've paid for. And they are being treated like you or I would treat my son with giving pocket money. And they're like, Dad, I've run out of money. And they're like, I gave you money for a week. How can you tell me you've run out in 3 days? You need to justify it to me. No. Meanwhile, the government is not investing that money as per the model I described as to how health insurance is run. They are chopping the money. If now we were to tell this government to account for all the monies they have capped from the NHIS, there probably would be chaos. And so, if you ask me, can the NHIS fund the renal dialysis? I've already told you nowhere in the world is that funded by the private person.
But it was being funded by the private person.
Because we have conspired to create a lack of liquidity for the National Health Insurance. We've conspired. We have conspired. And so, to answer your question, if the government was brave enough today to say, you know what, we realize we got it wrong. We've taken off the cap, which is what the NHIS is now asking for. And I like the boldness of Dr. Abban Acosta now that he's come out to say the cap was wrong then.
It's wrong
and
now.
it's wrong now. They need to remove the cap and they need to give them their money. Why previous CEOs of the NHIS were quiet is a multi-million-dollar question. If the government did that and the 2.5 was going straight there, I can tell you that the NHIS can even fund for all the people on the renal dialysis. Yes.
If they have access to their funds,
Their
yes.
funds. Because then their fund managers and the actuarial scientists would work out a model and say, this is the money we have, and they can go into some form of arrangement with their providers. But you know what? Because now the government is shut out of the capital markets, we're on an IMF program. If they remove the cap and give that money to the NHIS, let's not talk about the arrears, but say that cash flow is not going to go.
Yes.
There'll be a huge hole in the Consolidated Fund, and it's an election year. Do you think they're going to do it?
Will they ever do it?
When the citizens understand, and that is why I'm explaining it in simple language.
Simple terms,
Like I always say, things are not complicated. It is the person who wants to hoodwink and gaslight you who makes it complicated. And that is the sort of politics we have been playing. So if you ask me, would we ever get it right? Yes, we need to get it right. We need to get it right simply by making this an election conversation. We need to get a commitment from anyone who says he's going to run this country that we are not idiots. We've paid money for a reason, and that they are going to commit to ring fencing. Do you ever pay VAT and say that's going to the Consolidated Fund or it goes to GRA? It goes to the VAT Secretariat. Why can't NHIS have theirs? So they should commit to doing exactly what
The law says.
Act says and give them their money. But they would only do it if you and I, speaker, and the man on the street understands that this leverages the quality of care he's going to get should he go into a health facility with that NHIS card. And it leverages the viability of even the health facilities so that they will be there to treat him. And he starts making the right noises. Then yes, we'll do the right thing.
Okay. Will I be right to say that